All right, case 5. Any takers?
Sebaceous carcinoma?
Yeah, exactly. This looks like clearly a malignant neoplasm. It's blue and basaloid, real ugly nuclei there. Let's see if I can get them in better focus. Lots of mitotic activity, mitosis, mitosis, mitosis. You might think of basal at first, but it doesn't have palisading or clefting or stromal mucin. So we got an ugly kind of basaloid looking tumor. And whenever you see a tumor that looks ugly and basaloid, if you're having trouble telling between basal cell carcinoma and squame because it's so ugly, always think of sebaceous carcinoma. Because looking at this field right here, there's not really much obvious sebaceous differentiation. There may be a little bit of foamy bubbliness, but I don't see well-formed sebacites. Here you start to get nice, obvious lipid vacuoles that indent the nucleus, although most of the cells are kind of univaculated and not multivaculated. So it can sometimes be hard to tell, do I have a squame or some other carcinoma that's got just some clear cell change or vacuolation, or is it actually full-blown true sebaceous differentiation? And I feel like in sebaceous lesions, it's usually you can either tell it's malignant, but you're not sure if it's sebaceous versus squame or basal or something else, or you can tell it's sebaceous, but you have trouble deciding if it's malignant or not. So it depends on whether it's kind of a poorly differentiated sebaceous carcinoma like this one, or the well-differentiated ones, which can be hard to tell apart from sebaceous adenoma and sebaceous sebaceoma. Look at that atypical mitosis right there. Yikes. Big, huge guy. All right, so Muratori syndrome, sebaceous neoplasms are associated with. Muratori syndrome in some cases, and particularly if I see them in young people or multiple, like sebaceous adenomas or sebaciomas in young people or multiple lesions, I think of that. And also sebaceous carcinomas when they occur off of the head and neck. The ones that occur around the eyelid are usually not associated with Muratori. And the ones elsewhere on the head and neck sometimes can be, but still the majority are not. And then elsewhere, like on the trunk or the extremities, the majority are associated with Muratori. So that's just kind of a general rule of thumb. But see right here, I mean, that's ugly cells, but you would really have trouble telling it's sebaceous. So you can use a dipafillin to highlight those vacuoles. We've also found that factor 13A AC1A1 clone, only that clone works, and it highlights the nuclei of the sebacites in benign and malignant sebaceous proliferations. EMA will stain them, but it's not specific. It stains other stuff too. The reason there are so many stains is that none of them are totally perfect. You know, some of those cells there, I would actually even wonder a bit about Merkel cell at first glance.